During pregnancy, it's generally recommended that women avoid some common ingredients we use for acne and anti-aging. Specifically, retinoids and benzoyl peroxide and salicylic acid. I recommend that women switch, if they're using a retinoid or salicylic acid for their acne, to an alpha hydroxy acid product. That would be glycolic, lactic, or perhaps one of the fruit acids to help exfoliate the skin on the surface and within the pores. It's also very important to use extra precautions with your sun protection. Many women find that they first develop something called melasma, or the mask of pregnancy, during a pregnancy. That's a mottled pigmentation they see primarily on the cheeks, the upper lip, and the sides of the forehead. Once you have it, it's not the easiest thing to treat, and often you have to wait until after pregnancy and being done with breastfeeding before we can use the ingredients that are most helpful. So be gentle and see your dermatologist if you're having problems that aren't resolving with your over-the-counter care.